everybody. Happy Friday. Welcome to another at-home edition of our Friday Live. Today we're going to talk about what's the best thing to do, what's the best course of action or treatment plan when you roll an ankle. We're going to talk about this today because some of you may have followed my story that about 3.5 weeks ago, on a Monday night before he was supposed to go out to his track practice at Spire, our 14-year-old son rolled his ankle in the driveway shooting basketball hoops in his Hoka slides. So he learned a valuable lesson that day. So I used that story to share how I treated his ankle, because what some of you may also know is we have some fast running kids in the Neesett household, and this weekend is the New Balance National Meet happening in Boston. So we had a limited time and a big trip planned and some big goals to have this kid run on the national stage, which happened today and yesterday. So what do you do if you roll your ankle? That's a very, very good question. And I guess I want to start by saying there's a lot of different things we can discuss. First of all, how do you know how bad it is, right, when you roll your ankle? Because it sometimes takes some time to assess that. And there are grades of ankle sprain, right? They range all the way from a mild rolling to, if it's severe enough, if you roll that ankle hard enough, with enough force, you can actually sustain a fracture, because those ligaments on the lateral part, usually outside of the ankle, will pull that fibular head, which is the bone on the side of the ankle, a little piece of it off as it's rolling. So it can go from a mild sprain all the way up to a high ankle sprain, may or may not include a fracture. So the first thing that you can do to figure out how bad it is if you look down and there's visible deformity to the ankle, if it doesn't look right, you probably did seriously injure it, fracture, dislocate it, and you won't be able to walk on it. So a serious ankle injury from rolling it, either that includes a significant fracture or a dislocation, which can happen to you, won't be able to put weight on it. If you can walk on it, chances are it's okay relatively. You're injured, but it's okay. So, and then what do you do? Because traditionally, we have been taught that rest, ice, elevation, and compression are how you handle an acute injury. And very, very, by and large, most often that is the case. There is increasing evidence and movement in the therapy world that early activation or early movement of an injury, when it's been assessed, is helpful. And so that's what we did with Caleb. It got swollen right away. As soon as he came in the house, you could see the swelling around that lateral ankle. He was able to walk on it. There wasn't immediate bruising. And for that night, it was immediate rest, ice, elevation, and compression. We used an ice bag, and he had it on for 20 minutes, and then he would take it off. And at the top of every hour, he repeated the ice. We put the leg up above his heart, and we ace wrapped it, and that's where he spent that night. The next day, he was able to walk on it. We wrapped it up. He went to school. We also used a supplement called Inflavonoid Intensive Care, and that is a supplement made by Metagenics. It's a provider-based or medical grade. You have to get it through a provider. It's a medical grade supplement that helps with inflammation. We chose not to use non-steroidal anti-inflammatories in this case, and a lot of times we prefer to do the more herbal, holistic route because non-steroidal anti-inflammatory medications, though they're necessary at times and appropriate, they can slow down the healing process. So we use the herbal alternative. It's turmeric and boswellia and ginger and things like that. And he took that for several days. He went to school the next day. When he got home that night, we started something called cryokinetics. And this is where the use of ice and early movement really made a difference for him. There are different ways to do that, but what we did was filled up a bucket of ice and he stuck that foot and ankle in it for 8 minutes. That numbs things down and allows for the movement to be more tolerable. It will not allow you to move through painful movement. It will not allow you to move unsafely through painful movement. So once he was numb, for 3 minutes, we did range of motion and weight-bearing exercises. So he stood on his feet, he raised up on his toes, he rocked back on his heels, he did the alphabet and ankle range of motion, and we did 3 rounds of that. 8 minutes in the bucket, 3 minutes on the range of motion. And the other thing we started that night was he had some laser treatment. We are regularly pairing up and teaming up with Subject Natural Health and Wellness. Many of you guys know that. And we headed over to their place for laser, which increases healing time, speeds it up, and compression boots. So we continued with that type of treatment. The ice we probably only did for about 24 to 48 hours, really, if I'm thinking about it. He did the cryokinetics once. He definitely could have done that more often. And then the compression, we really only did the ACE wrap for about 24 hours or maybe, 24 hours. We did some taping to kind of help pull the swelling out. There's a kinesio taping technique that we use to pull the swelling out. And he started early range of motion and weight bearing within 24 hours of rolling his ankle. There are a series of tests that we can run. You guys often hear us talking about, like, do you need to go to a doctor? Do you need to go get an x-ray? Like, how do I know that it was safe to treat my son with the ankle sprain? Well, there are a series of tests. As therapists, we have special tests that we can do that we put the patient through to test for or predict the presence of fracture. And all of those tests were negative for him. So what I did then, within about 3 days, I think it was the 3rd day, that I was able to do some range of mobilization to his foot and ankle. Here's the deal, you guys. When you roll your ankle, it changes the mechanics of that ankle joint. It's a complex joint. And our bodies are miraculous. So I'm telling you, if you've ever rolled your ankle, it's very likely that your mechanics have changed and your body has accommodated and you've gone about your life without the full range of motion. It's functional for you. Your body's compensated. But if you're trying to do something at a higher level, it may end up becoming a hitch in your giddy up, because if you don't have full range of motion at one point in your body, you're looking for an injury, especially as you add speed and load and force. So the ankle joint, after it's rolled, needs to be mobilized. I've talked to you guys about that before. So we did mobilization. Within those first 2 or 3 days, he had full range of motion of his ankle in all directions, which is pretty remarkable because you usually have some pain, especially with the inversion movement or your toes going in. And he started some strengthening exercises with resistance band and balance exercises, because those are important after an ankle injury. And I think he missed 4 days of running. On that 4th day, I put him through a return to run plyometric program, which there are several different resources you can Google if you're looking for one, but there are some evidence-based programs out there that test your body's ability to jump, because running is jumping. It's push off. And if you can tolerate the number of foot contacts for one of these return to run programs, then you are theoretically ready to run up to a mile at that point. He was able to do that, and on that 5th day he ran a few miles easy with his teammates that weekend, which I did not know if he was going to be able to do, but he did go on and compete in a track meet. He ran the 1600, and I think the following week he had to limit one track workout because there was a little bit of discomfort. Actually, the bottom of his foot was bothering him, and that was it. The rest of it has been returned to full go, and yesterday and today he competed at the New Balance Nationals meet. So the moral of the story is get your ankle checked by a PT. Get it checked quick if possible. If you've had an issue with rolling your ankle in the past, you probably will nod when I say you're at risk for repeating an ankle roll in the future because those ligaments get stretched out. So forever and always, you really should be doing some ankle strengthening exercises, some agility and proprioceptive exercises, some balance work. It's especially if you're going to be active, you need to stiffen up the mechanics of that ankle, and it really needs to be checked for full range of motion and mobility to get that back and make sure you're functioning at optimal levels. And don't baby it too long is my other take-home message from this, that there is increasing evidence that rest, ice, compression, and elevation has a place in every acute injury, but it can be shorter and limited. If you're able to put weight on it, then let's get you moving quickly. And we are always here to be the peace of mind and reassurance for you so that you know that you're going about it correctly. So if there are any questions about anything I talked about and you're catching this on a replay, just share them below. If you've got an issue that's holding you back, or if you've had an ankle roll in the past and you're not sure if it's optimal and going to help you live that long life, then we'd love to take a quick look at you and just give you a few things, maybe do those mobilizations that I've talked about and get you on your way. We are always here for you and aim to be your go-to provider when pain or injury strike. That is your take-home message for what do you do, what's the best course of treatment for rolling your ankle, with a little bit of a case study on what we did with my 14-year-old son very recently. Thank you guys so much for watching. Have a great Friday, a wonderful weekend, and we hope to see you soon.